This is RadPod, a podcast produced by ASMIRT, the Australian Society of Medical Imaging and Radiation Therapy. ASMIRT acknowledges the Boonwurrung people as the traditional owners of the land from which we record this podcast and pays respect to elders past and present. Welcome to everyone listening in to this first episode of our new podcast, RadPod. My name is Steve Lacey and I'm the Director of Education here at ASMIRT. So in this podcast, we'll be focusing on many topics and issues related to the medical radiation professions, some clinical, but many non-clinical, and we'll be speaking with experts, researchers, and those with lived experience. And our target audience is going to be radiographers, radiation therapists, nuclear medicine technologists, sonographers, and medical radiation students. But a lot of what we talk about will be relevant to other healthcare professions as well. So just quickly, who is ASMIRT? Well, we're the peak body representing the interests of medical radiation professionals, and we support these professionals through things like advocacy, education, research and insurance, amongst many other benefits. So let's get started with this first episode. So for those of us who are medical radiation professionals, there are a lot of reasons why we're part of the profession. And I'd have to say that for most, this is due to the nature of patient care. But what happens when we flip the coin and are forced to be patients ourselves? We have to look at our profession from a different perspective. I've certainly been a patient before, requiring images, and my experiences were not always what I imagined that they would be. We also have those who were patients prior to entering the profession, and their experiences have shaped how they work now. And today I'm joined by two people from these professions who have done just that. So our first guest is Karim Yacoub. Karim is a clinical radiographer with Austin Health in Melbourne and also a lecturer for the Bachelor of Medical Radiations in Medical Imaging at RMIT. Welcome, Karim.
Thank you for the kind welcome, Steve.
And our second guest is Jarrod Prohasky. So Jarrod is a radiation therapist currently working at the Olivia Newton-John Cancer Centre, also in Melbourne. Welcome to the show, Jarrod.
Thanks for the invite and welcome, Steve. I'm very happy and excited to be part of the RadPod session.
That's good to hear, mate. Now, for those listening who do not have a background in either of these professions, I'd like to be very generalised and say here that radiographers use advanced imaging technology to create images of the body using things like X-rays and CT scans, MRIs, whilst radiation therapists create radiation plans and work with equipment to blast cancer through targeted radiation. So let's start with your experiences, Karim. Tell us about your patient journey.
Thanks, Steve. So essentially it started at a very young age, at around 18 months old, with multiple hospital visits, a lot of sickness, and there was no clear diagnosis. So I went to the ED a lot of times because my mum thought I wasn't growing, a lot of gastro, etc. And there was a bit of failure to thrive from the age of 6 months.
Yeah.
And similar symptoms came up during a trip to Egypt, and I had a severe case of gastro, and that was at the age of 18 months old. Now, during that trip on the holiday, we went to the doctors following that gastro occurrence, and I was actually diagnosed with rickets, which was due to cystinosis. So what I really want to highlight here is the rickets was a secondary diagnosis due to an underlying condition called cystinosis.
All right, so until recently I hadn't actually heard of cystinosis, only when I started talking to you initially about this podcast. Can you just give us a bit of an understanding as to what cystinosis is?
Yeah, absolutely. So cystinosis, it's a very rare disease, and essentially we all have cystine in our cells.
Yep.
But with cystinosis, this cystine doesn't escape the cells as in a normal person it would.
Right.
So therefore it leads to damage to the more sensitive organs such as the kidneys.
Right. And how, like you said, it wasn't very common. How uncommon, like how many people have it?
So there's only around 3,000 people in the world that are diagnosed with cystinosis, and there's less than 60 in Australia.
Oh, wow. That would explain why I haven't heard of it before. And now that this diagnosis had happened, what treatment was required from your perspective?
So I'm on medication to assist the cells in getting rid of the cystine from the body, but it is a progressive thing. So you need to really stick to a really strong regime of medication. And due to that, as I mentioned, it affected the kidneys, which led to eventual failure.
Okay. And what does that mean for you then?
So at the age of 8, I was on dialysis.
Yeah.
And then that led to a transplant by the age of 9.
Wow.
For my first transplant.
Gee, that's really confronting news to hear. And you obviously got the transplant at the age of 9 after that dialysis. How did you go after that?
Yep. So I lived my as normal as possible life as I could. And then because of the first transplant failed, because that's what happens with over time rejection of the transplanted organ, then I needed a second kidney transplant at the age of how old was I? At the age of 21, and that was in 2017 when I was at university.
Yeah, right. So what did that mean for your university experience if you're getting another transplant while you're in the middle of a university course?
So I would have to go to dialysis 3 times a week whilst I was on placement in third year and undergo 4 to 5 hour sessions of dialysis, which was a really tough time because I had to balance my health as well as my studies and essentially my future professional career. And that's also in addition to all the frequent blood tests and the medical appointments.
Wow, that sounds really intense to have to do a placement and concentrate on that, then get virtually no downtime afterwards. How long was the dialysis needed for?
So the second time during university, dialysis was for around 8 months until I had my transplant. It was kind of really a fortunate time because I got a call for the second transplant on Easter Monday in 2018.
Yep.
And ironically, it's a 6-week recovery period post-transplant if everything goes well. And it was that exact length of time that I had placement booked in for, so 6 weeks. So I contacted the university and I said to them, I'm having a transplant. I got a call from the doctors, so I'm having a transplant tomorrow and we'll have to delay the placement. And I was very grateful for their support and understanding. And so I was able to continue my studies as normal, undergo the transplant, recover and complete my studies and ultimately graduate and become a radiographer.
So basically you got the call to get the transplant at the time when you were about to start your clinical placement. And so that basically meant that clinical placement was gone. You couldn't actually do that then. And so did you have to make up that clinical placement time?
Yes, so I made it up during the summer break.
Yep. Okay, so that means that instead of having a summer break,
Yep.
You're actually spending that entire time having to do your clinical placement then as well.
Correct.
Oh my God, that's incredible. And look, hats off to you for making it through it. But it does sound like the uni were at least really supportive and it's actually gotten to where you are today. So that sounds great. So based on that, why did you want a career in medical imaging then?
It basically came down to my really good experiences in a hospital as a patient. So I always wanted to do something in the healthcare field. Then I found the mix between the things involved in radiography and learning more about it in year 12 when I met a radiographer that actually works in the field at the moment. I found that really inspiring and I thought it's a really nice way to work in the medical field, give back to patients, play a key role in their healthcare journey. So that felt like the perfect fit.
Fantastic. Jarrod, let's move on to you. Tell me about your journey as a patient. What was your experience like?
Yeah, no worries, Steve. So when I was 16 years old, for about a month or more, I felt really tired, nauseous and dizzy. I went to the GP lots of times and I kept on getting diagnosed just with ear infections.
Uh-huh.
And then we switched to a different GP who got some blood tests done straight away. And then within a few hours of getting results back, the GP gave us a call and they said to my parents, you need to rush your child to the Royal Children's Hospital.
Right.
After that, I arrived at the Children's Hospital. They did more bloods and I got 4 bags of blood given really quickly. And all of my blood counts were rock bottom and pretty much as low as they could be.
Wow.
Over the next couple of days on Christmas Eve, it was just before Christmas when all this happened, I received a diagnosis with AML or acute myeloid leukemia.
Oh my goodness. So on Christmas Eve as well. Gee, that must have been horrible.
Yeah, it was pretty rough. And because I was quite unwell, I had to start treatment very, very quickly.
Mm-hmm.
So by the time New Year's Eve came around, I started my first chemotherapy treatment and had some nice views over the city from the Royal Children's Hospital.
Well, at least you've got that to look back on, so that's good.
That's it, best spot for the fireworks. And then over the next 9 months, I had an intensive chemo-based treatment with a few complications towards the end before finally getting into remission.
And so 9 months of that, did you get to go home in between chemo doses or anything like that?
Over those 9 months, I probably had around about 10 days at home and the rest of that time was spent in isolation rooms at the Royal Children's Hospital.
Wow. So not only did you get diagnosed on Christmas Eve, for the next 9 months, you only had 10 days at home. Not only that, I'm assuming you were about to go into VCE or something like that at the time?
Yeah, correct. I just finished year 10 and then started my treatment and missed all of year 11.
Wow.
And then down the track, for around about 18 months, I was actually really, really well after I finished my treatment.
Yeah.
And then I never would have known this time because I had no symptoms, no side effects, felt really, really good. But I went in for a checkup and the doctor said that I had relapsed and my AML had returned.
And was that based on a blood test or something?
Yeah, so it was a combination of blood tests and some bone marrow aspirates and trophine. So a couple of bone marrow tests along the way as well.
Yep.
And then for the next course of treatment, it required another intensive chemo session, a total body irradiation session, and then a bone marrow transplant, which took around about another 6 months.
Oh my goodness.
After the second diagnosis, though, I got a very different and a very positive mindset, and I was really, really determined to do well, to survive and go through, I guess, this journey a second time, because I knew already once I had beaten it, so I could do it again.
Yeah.
So while mum and dad were very sad and very upset when we got home after the new diagnosis, I was running around the house singing "I Will Survive" and "Ain't Nothing Gonna Break My Stride," and just carried a very positive mindset onwards after this experience.
That's fantastic. And I think that's a big difference in being a child and being sick than being an adult and being sick. I can't imagine an adult probably doing that stuff anyway. With the bone marrow transplant, did you require isolation afterwards?
Yes, I did. At the time when I was having it, it was generally a period of 100 days of isolation post the transplant.
Yeah.
For a lot of this time, I spent it in a room at the Royal Children's Hospital, which was called the Fishbowl.
Okay.
Which essentially was an isolation area that had its own filtered air supply to create a germ-free environment while I had no immune system.
Yep.
They called it the fishbowl because everyone would peer through the window, but they would only come up to the window and look in. And occasionally, if people did come in, they would wear protective gear. So essentially what you see in the COVID videos when people in hospitals are all dressed up in their gowns and their gloves and their masks and pretty much everything.
Yeah.
If anyone wanted to pop into my room, they did the full dress up to come see me.
So you were the fish in the fishbowl, essentially.
Correct.
Is that right? That's what people were peering in to look at. I think you could also be known as the bubble boy at the same time, right?
Yes, I guess you could say that. Had a lot of people walk by and peer in the room, but not always come in.
Yep.
And when they did, they adhered to very strict infection control procedures. And it was a little bit strange having everyone come into my room, but never seeing any faces or any smiles or any I guess, facial emotions for that whole journey while I was in there.
Yeah, and I think that's something that also came out of COVID, I think, when we were all wearing masks, is that facial expression was one thing that really got lost in that. And I think that was a really hard thing, particularly around children, was that children couldn't necessarily relate as well because they didn't see those facial expressions, which is what they normally react to. So
absolutely. It's amazing how expressions and body language play such a big part in what we do and our everyday life.
Absolutely. And so with the radiation, I know that the Children's Hospital in Melbourne doesn't do radiation therapy, so I assume you had to go elsewhere to an adult institution for this? Yes,
I had to go to a centre where the adults had their treatment.
Yeah. And what was the experience like in terms of being different from the paediatric hospital?
I think paediatric hospitals, the setting, they're so patient care focused when dealing with children. In the Children's Hospital, there were no visiting limitations for my parents to come in and see me.
Yeah.
Throughout most of my journey, they pretty much came in every single night and they normally slept in the really uncomfortable couch right beside me in case I needed anything through pretty much my whole journey.
And they were not allowed to do that at an adult hospital?
No, in the adult hospital, they had to go once visiting hours had finished. So it was a bit of a change for me, I guess, losing my main support system. Yeah,
and probably a bit scary too, being 16, 17 years old and all of a sudden your parents having to just leave for the night as well, right?
Yeah, absolutely. Absolutely. It was very different not having the colourful rooms, the fun environments, the activities that are everywhere on hand at the Children's Hospital. And basically they had anything that you possibly could want or need to keep you entertained at the Children's Hospital.
Yeah.
Definitely a lot missing once you jump into the adult world.
Yeah. And then what about like your fellow patients? Obviously you've got at the Children's Hospital, you've got other children that are sick and that. All of a sudden you're now a child in an environment where there's adult patients. Was there much of a difference there?
Absolutely. I think the different cohort of patients was actually really confronting. Being a children mixed with all the very sick and very elderly patients and seeing how unwell some of them looked, the pain groans that they would make, it was really, really confronting. And I discovered very quickly the behaviour of a sick child versus a sick adult is very different and something that was very hard to be around.
And I think that's the thing. I think sick children still have that kind of positive mindset, as you talked about before as well. Now, Karim, you mentioned before that you had a good experience in hospital as a patient. What made these experiences so good?
I found the staff, the nurses, the doctors, the MRPs, they were all very caring and very high attention to detail. They were always on top of things. For example, if I wasn't feeling well, they'd act upon it very, very promptly. And I know that my family also very much appreciated that, especially when I was younger, because, when you're a paediatric patient, things can go wrong very quickly. So that attention and always being on top of things.
And what about anything negative? Was there any negative experiences that you had as a patient?
Yeah, some of it I still relate to, unfortunately. But, taking lots of medication daily, that's a big part of my day. And you kind of get used to it and accustomed to it as you grow up. But I think one of the more scary things is always when you're being asked to do a blood test or an ultrasound and there's a fear of uncertainty of what could come out of those tests.
Yeah.
especially with things a bit more intrusive, such as biopsies of the kidney when the doctors are concerned about the kidney function. But then at the same time, the biopsy, there's a risk of ruining the kidney or damaging the kidney.
Yeah, because they're about, like, oh, here's my kidneys that are wrong, but now you're about to prod it with a needle. So
absolutely, exactly. So there's always a little bit of background uncertainty, I'd say.
Yeah.
But, you just learn to live with it and move forward and keep moving onwards and upwards.
Yeah, wonderful. Jarrod, did your experiences make you want to do radiation therapy?
Yeah, I think so. I think from a very young age, I always wanted to do something in the healthcare setting, but I wasn't 100% sure exactly what that was going to be. After growing up and getting a little bit older, I always loved playing sports, and you couldn't get me off the tennis court or stop me from running when I was growing up. So I always thought something in the sports management field, like potentially physio, would be a great option. So initially I started my journey pursuing to be a physiotherapist.
Yep.
And then after 2 years at university, I feel like I kind of had a little bit of a calling to switch into a field where I could give back to cancer patients. So that kind of changed my direction and made me want to go down the path of working in radiation therapy.
Yeah, okay. What kind of things do you do now in your role that are a result of you being a patient?
I've got a very strong focus on patient care and ensuring that everyone receives the best care possible, whether that be emotional support, physical support, any kind of support that I can provide, just making sure that all those bases are covered. I think I've got a bit of an increased understanding of a patient's journey, and I feel like after going through that experience, potentially an increased emotional intelligence when interacting with patients.
Yeah, that's interesting. Yep.
Also, there's things that I guess from being a patient, you kind of realize things that you want to be done. So something that I try and focus on is just doing one patient at a time. So no matter what the schedule looks, making sure that you are just working with that one patient at a time. Working with just one at a time, it stops you from rushing, feeling flustered. And when you're a patient, you can really feel the stress and when staff are flustered. So I think it's always really, really important to make sure you slow down and you only focus on one patient at a time.
I think that's an important point, because I think that happens quite a lot when you've got a busy waiting room full of patients, particularly in an area where you've got, say, an orthopedic clinic and you've got lots and lots of patients all waiting to be done. And a good way to kind of think about that is go, I can only do one at a time. Those patients aren't still going to be here at 5 o'clock when everyone else needs to go home. You just have to just plod along and just do one at a time, but give that care to that particular patient that you're doing at that time so that your energy is completely focused on that one patient, right?
Yeah, I couldn't agree more, Steve. Couldn't agree more. Something else that came out of it is being in the hospital environment, you realise that everyone goes through journeys very, very differently, even if they've got the same thing. So I think just adapting communication styles, body language, all of those things can make a big difference. And after being, I guess, the bubble boy or spending so much time in isolation, the nursing team, the doctors, every healthcare professional that came in to see me, they always stressed about appropriate hand hygiene and hygiene and making sure that everything was germ safe. So I'm always very vigilant and make sure that I perform my hand hygiene well before every patient and do everything to keep patients safe in that aspect as well.
Yeah. Does that mean that you are the local hand hygiene champion within your department?
Absolutely, Steve. I've been on the auditing list for a while.
Good for you.
And I'm a strong advocate for keeping the patient safe and also keeping ourselves safe with adequate hand hygiene.
Yeah, exactly. And I also think it's really hard to explain something to someone when you haven't experienced it yourself. For years, I would explain to patient the effects, for example, of IV contrast. So, we get that warm feeling, that taste in the mouth, the feeling like you're wetting your pants and that. And you explain that to patients all the time. And then I remember one time I actually needed a CT with contrast after an accident, and I had to experience all of that for myself. I did get the warm feeling, just as I would explain it to others, but it actually felt a lot different to what I was expecting. I kind of thought that my entire body was just going to get completely hot, but it actually felt to me like it was almost like just my arteries were the ones that were getting hot. And so it was actually a really, really different experience that I was expecting itself. So having that perspective does change the way that you then explain that to your patients as well. Karim, what about you? You work clinically and you also teach students. What do you do in both of those roles that have been shaped by the experiences that you had as a patient?
I think what Jarrod mentioned earlier was pretty much bang on. Each patient has a journey and a unique story as to why they're in the X-ray room or the CT room.
Yeah.
But also it's really important to recognize that every student also has a story. Some students are more open to share their difficulties in the background.
Yeah.
Some are not. So I feel that because of my experiences, I've become more empathetic and understanding and open and not judging the students when things aren't going as they should be, for example.
Right.
In extreme cases, I also see myself as someone who is open and can talk to both the students in the university setting and patients, of course.
Yep.
And, academia, it's not only a teaching role, but it's also a supportive role, making sure the students are well supported. You need to have extra sensitivity when you're working with these students or patients.
Yeah.
It's all about the patient experience. So you need to remember that when you're interacting with a patient, as a radiographer, you're unlikely to remember them because of how many patients you've x-rayed or you've CT'd that day.
Mm-hmm.
But for them, it's that 5 minutes or 10 minutes that they've spent. They will remember that for the rest of their lives. And I'll draw on a cheeky example. Before I started at RMIT, we had to do a site visit at an institution to kind of confirm that that is what we want to sign up to. Now, I'm not sure if you remember this, Steve, but I actually did one of my site visits at the Royal Children's Hospital. And I came on time because I'm a good man, of course.
Yep.
But there was a fellow student that was going to do a site visit and they were 10 minutes late.
Yep.
And I still remember that moment. And we said, nope, they're late. We're going to move on. And what I'm trying to draw from this story is, for me, I was the student in this case, and Steve, you're the educator, and I still remember that to this day. So that's what I try to reflect in my teaching of students, is that we need to treat each patient equally and give them the best care possible.
I remember that too, Karim. I do remember that day and showing you around, and you were a very enthusiastic student, so it was great to see. I think we also just have to remember that we were all students once and we were all nervous and trying to make a good impression on people, and that I think the better professional relationship that you have with a student, the better experience it's going to be for both of you. So Karim and Jarrod, thank you both so much for sharing your stories, giving us a great insight into your professional attitudes, and first and foremost, I guess, thank you for both being the very first guests of our new RadPod podcast. Just to finalise today, can you just each give one or two final tips for our listeners on what you've learned that you think they should do in their own practice? Karim, we'll start with you.
So a final tip, treat each person you're working with dignity and respect.
Yep.
And always give it your best shot every day.
Great. And what about you, Jarrod?
I think mine are pretty simple. Always smile. Smiles are contagious and happiness spreads, so always keep a smile on your face when you're walking.
And I'm just going to add to that as well, you can still smile with your mask on. People can still see it. Yep.
Very true. And I think number 2 would just be to stay calm always and just focus on one patient at a time, no matter how busy a day gets. From a patient's perspective, you can really see and feel the stress and pressure workers are under. But by staying calm, you can keep yourself calm and your patients as well.
Yeah, absolutely. Karim, Jarrod, thank you very much for being our first guest on this podcast.
Thanks, Steve.
Thank you, Steve.
Thanks for listening to RadPod, a podcast produced by the Australian Society of Medical Imaging and Radiation Therapy.